The international study traced nearly 14,000 patients with gastro-intestinal cancer between 1998 and 2011 and found that people aged 50 to 65 who regularly take aspirin for 10 years could cut their risk of bowel cancer by 30% and cancers in throat and stomach by 25%. The survival chance is twice higher than those who do not take the tablets. The result, which has been presented at the European Cancer Congress, may open a new chapter for the tablet in cancer treatment and even a wider domain. Professor Jack Cusack, head of Center for Cancer Prevention at Queen Mary University of London, explains the principles of the experiment.
So in 2014, we were able to put together a comprehensive risk-benefit analysis for the role of aspirin in the general population. And the results were really quite positive. The benefits in terms of cancer prevention dominated everything else. So that we felt that the benefit-harm ratio was clearly very positive for most people between the ages of 50 and 65, where we think that a low-dose aspirin for 10 years is probably a good idea.
Marketed in 1899 by German pharmaceutical company Bayer, aspirin is one of the most used medicines today. It is widely used as painkiller and daily dose in heart attack and stroke prevention. It also has effectiveness in protection against blood clots, diabetes, dementia, and pregnancy complications. But before the tablet stretches into a new sphere, some questions still wait for answers from the researchers.
It's quite clear that aspirin does prevent some cancers, notably colorectal cancer, but also stomach and esophageal cancer. What we don't know for certain is what ages are best for actually taking aspirin. We think that because the bleeding at risk become higher as you get older, there probably is an upper age. We also don't know what the best dose is, whether it should be a standard aspirin around 300 milligrams or a baby aspirin around 75 to 100 milligrams. And also, I think there's some interest in whether you can prevent bleeding associated with aspirin by, for example, doing a test against the so-called Helicobacter bacteria, which actually is associated with a lot of stomach bleeding.
The researchers in the Netherlands are currently studying the effect of an aspirin daily dose on the overall survival in the elderly patients with colon cancer. They hope that it will then be able to provide convincing proof for a wider use of aspirin treatment so that more patients will benefit from these new studies.